Welcome to The Explainer. We're all about breaking down really complex topics by going straight to the research.
You've seen the images, right? Hospitals just completely overwhelmed, whether it's a pandemic, a natural disaster, or something even worse. And sure, having more beds or more doctors, that's important. But the real key to surviving a crisis, to, bending without breaking, it's something much, much deeper. So today, we're going to dive into what makes a healthcare system truly resilient. And we're not just guessing here. This is all based on a huge analysis of thousands of research papers. Okay, so what do we even mean when we say resilience in healthcare? Let's get a really clear definition on the table. The best way to think about it is like an earthquake-proof building, right? It's not just about being super strong. It's about being flexible enough to absorb the shock, to sway with the force, and most importantly, stay standing and working. That's the whole idea. And look, this isn't just some corporate buzzword. The idea of resilience has absolutely exploded. It's become one of the most critical areas of research out there, especially just in the last few years. So the source material we're digging into today, it's a massive analysis of over 3,000 scientific articles all about healthcare resilience, published between 1997 and 2023. And this chart just says it all, doesn't it? Look at that jump. The number of papers on this topic just skyrocketed after 2019. And, well, we all know why, right? Global events pushed our systems to the absolute breaking point. So, when researchers sifted through all that data, a really clear pattern emerged. It turns out true resilience is basically held up by four main pillars. All right, pillar number one is the foundation. This is all the stuff, the rules, the plans, the physical infrastructure that has to be in place before a crisis even thinks about hitting. Yeah, this is all about getting ready before the storm. We're talking about having clear emergency plans locked down, public-private partnerships ready to go, but also the physical stuff like backup power and water, and making sure your medical supply chains aren't so fragile that one little disruption brings the whole thing crashing down. Okay, so pillar number two is all about action. This is what happens when disaster actually strikes. How does the system perform under pressure? This is where all that planning meets the real world. It's about drilling your staff so the response is almost muscle memory. It's making sure you have backup communication systems, because the main ones will fail. And of course, it's about stockpiling the critical supplies so we don't see those awful shortages we all remember. And the stakes here are, well, they're incredibly high. When emergency resilience fails, the consequences are tragic. Horrific events like the Bhopal gas disaster are a brutal reminder that when we fail to plan and respond, the cost is measured in human lives. Which brings us to pillar number three, the human element. Because let's be honest, you can have the best plans and tech in the world, but a system is only as strong as the people running it. This is all about protecting the protectors, It means having real, accessible mental health support for the stress and trauma they face. But it's also about building a culture that stops burnout before it starts. Things like peer support, flexible schedules, and just making people feel valued. And that brings us to the final pillar, the one that kind of ties it all together and points to the future. And that's technology, using tech to make the whole system smarter, faster, and way more adaptable. So this is where things get really cool. The system gets smarter, using AI to actually predict outbreaks. It gets faster, with things like telemedicine for remote care. And it gets more adaptable, with robots helping out with tasks like disinfection, or even using blockchain to make sure the supply chain is secure. So when we look to the future, the research is crystal clear on this. Technology isn't just some nice-to-have tool. It is fundamentally driving what resilience will look like from now on.
Okay, this is super interesting. The analysis did something clever. It used PageRank, which is kind of like how Google figures out which websites are most important, to see which research papers were the most influential, not just the most cited. And guess what? The most popular papers weren't always the ones shaping the conversation. It was the newer, tech-focused research that was really pointing the way forward, even with fewer citations.
So what the research does is it lays out this whole path forward in 5 clear steps. It all starts with the technical approach, like using AI. That's driven by crises or new policies. That, in turn, requires collaboration between governments and tech companies. The output you're aiming for is a stronger system. And finally, you have the real-world application, like better telehealth or emergency response.
All right, so we've looked at thousands of studies, we've mapped out the 4 pillars, we've seen where technology is taking us. So what's the big takeaway here? What does this all really mean for us?
Well, it really boils down to this. A truly prepared healthcare system isn't just one thing. It's a complex, interconnected machine. It's got to be flexible, and it needs all 4 of those pillars we talked about: solid policy, a practiced response plan, supported people, and smart technology, all working together perfectly to handle whatever comes next.
And that really leaves us with one final question to think about. This whole idea of resilience. It's not just some abstract concept we talked about. It's a very real measure of how ready our own communities are for what's coming.